Next here tonight, the battle over transgender therapies in Florida now heating up. State health leaders are pushing to deny Medicaid coverage of gender treatments. The final decision could come as soon as this week. And tonight, Capitol reporter Forrest Saunders tracking the new developments from Tallahassee.
If this rule goes through, Florida joins a small but growing number of states explicitly excluding Medicaid coverage of transgender therapies. 9 at the moment, Florida making it 10. If approved, the rule change cuts Medicaid coverage of puberty-blocking meds, hormone therapies, and sex reassignment surgeries to combat gender dysphoria. And hundreds have weighed in on the idea. As of Monday morning, ACA received about 1,200 total public comments from opponents and supporters. Even Florida's Surgeon General tweeting Florida doesn't support the medicalization of minors with gender dysphoria because the benefits are unproven and the risks are extraordinarily high.
I don't know if I'll be able to fully carry a child. And I might be at increased risk for certain cancers.
Dr. Joe Latipo also shared this clip of Chloe Cole, a fellow supporter of the change. The 17-year-old regretted her decision to start the treatments at 13.
This was not the path that I should have taken.
But there are plenty in the medical community supporting the treatments, the American Academy of Pediatrics among them, saying the therapies do reduce gender dysphoria and improve mental health.
The vast majority of medical experts fundamentally disagree with what the state is proposing.
State Rep Carlos Guillermo Smith, a strong LGBTQ advocate, warning upwards of 9,000 transgender Floridians will be impacted by the rule change. Cutting access to their treatments, he says, could have dire consequences.
But it's more than just being mean-spirited against trans people. This rule change may cost lives.
ACA Secretary Simone Marstiller, a self-described Christian conservative, will have the final say on whether to adopt the new rule. And as agency head, she'll have as much time as she wants to make that decision. It could come very soon or after review of that pile of public comments. The ACA Secretary is expected to approve this rule change, but that likely won't be the end of the debate. That's because groups like Lambda Legal say they are ready to challenge this rule in court, saying it is unconstitutional. That's the latest out here at the Capitol. I'm Forrest Saunders reporting.